Good evening, everyone. It is said that food heals, prevents, and cures cancer. Today, Dipali Bhasin, I'm a cancer survivor, and I'm going to be the MC for today's session. Today, the Forum for Breast Cancer Protection presents an informative and interesting webinar on holistic approach to cancer with the focus of the importance of diet in cancer. I would request all of you to put your questions or doubts, if any, in the chat box so that they can be addressed later in the session. Now, I would like to invite Dr. Mrs. Ramesh Sareen, Chairperson of the Forum and Senior Consultant at Apollo Hospital, Delhi, to guide us about the flow of events and tell us the significance of today's session.
And thank you the attendees, and thank you people taking part in this webinar virtual meeting. Thank you everybody for coming forward to give us a holistic approach to breast cancer. As you all know, that International Women's Day is celebrated on 8th of March every year, and is a symbolic of historic journey women around the world have taken to better their lives. It comes as a reminder that while a lot has been advanced, the journey is long and a lot more needs to be done. On 8th of March 1917, more than 100 years ago, thousands of Russian women took to the streets demanding change on this day. And so it's celebrated as women's achievements to raise awareness about women's equality. There is also a lobby for accelerated gender parity. It's a day when women are recognized for their achievements without regards to division, whether national, ethnic, or linguistic. On this occasion, I wish you all happiness, health, and prosperity. And today's symbol that I saw in one of the WhatsApp message said that be strong. You know, it's like a butterfly, and the four flies are saying be strong, be bold, be independent, be passionate. In this, be bold does not mean just be bold. If you have anything, you don't speak about it. So if you have any early signs and symptoms or anything which is not good in your body, just speak about it. Be bold to speak, not be bold to say nothing can happen to me. Be independent, which means that you are responsible for your life. So instead of saying that I want equality, I think you should also have the responsibility to your body, and to take that responsibility for a healthy life, for a cancer-free or other non-communicable diseases-free life like blood pressure, diabetes, and other non-communicable diseases, including cancer. You need to be responsible for yourself. So today we thought we'll bring to you one of the important factors among many others for a good healthy life is diet. Diet is being recognized as one of the most important factors in either preventing cancer or in improving the outcomes of cancer treatment. And you will be introduced to Dr. Shubham Pant, who is an associate professor in medical oncology at the MD Anderson, Houston, Texas, and a product of India, who's written a book. And I must tell you, we would give you the book details at the end of the session, that it's a very easily readable book, and it's a very well researched, scientifically proven facts book that I think we should all follow, whether we have cancer or we don't have cancers. In addition to the holistic medicine of diet, we also bring you three of our heart-rending, great survivors, great warriors, and great women with accomplishment to speak to you about how they became strong, whether they were strong or not, how cancer made them strong, and what advice they have for you who are attending at the end of the day. So with these remarks, this is a webinar which has been brought by the Forum for Breast Cancer Protection, which I'm sure you all have attended virtual meetings before, which was founded more than 15 years ago. And the main aim being awareness of breast cancer and a holistic approach to breast cancer, for which we give lots of awareness lectures and now do virtual meetings. And if any one of you need a help, we are there. You can contact any one of us. With these remarks, I would hand the mic over to the MC.
Thank you so much, Dr. Serene. Today being the International Women's Day, it's a perfect day to reaffirm our pledge to emerge, evolve, and empower ourselves towards greater health and well-being. Dr. Vinita Kapoor is Senior Consultant Radiology with specialization in breast radiology, be it mammography, ultrasound, or breast cancer follow-up investigations at Colonel Pant Imaging Center in Fortis La Femme. I kindly request her to introduce the three women of grit, determination, and perseverance now.
Thank you so much, Dipali. It gives me immense pleasure to be here today with women with grit, determination, and perseverance. I can only look up to all these women and say, wow, you are amazing. And I sometimes wonder, where do you get the strength from? Whether I look at you, Dipali, where did you get the strength from? You look fabulous. You carry on. You do so many roles. You're amazing. And I look at so many of the other women who I meet every day, and I say that what drives them? But I know each one has a unique story, a completely different story. Some of us are young, some are older, some have married children, some have babies, some are professional, some non professional. Today, I bring to you three women of substance, three women of real substance. And I'll start with introducing the new kid, as I call her, the baby. Her name is Aditi Mittal. Aditi, if you could unmute yourself, I'd like you just to tell them something about yourself and your story and what keeps you motivated the way you are. Love you, Aditi.
Thank you. Thank you, doctor. Happy Women's Day to everyone, even to the men who are a part of this. I think I got cancer twice. First, I got it in 2010, a year into my marriage. And then I got it in 2019, a year into motherhood. And everything was so new initially when it came to me. And I was 25, 24 actually. What kept me going initially, I don't really know what kept me going initially, because everything was so new. But I think I think when people talk about cancer survivors, they only talk about them. But actually, what helps us is, and I'm sure even other people who are here, even Dipali would agree with me, I think a very strong support system, especially your family, I think that matters a lot. The doctors, of course, I think I met the right doctors at the right time. And I'm so glad that I met Dr. Serene at the time where I think none of us had any clue about what is happening in our lives. And yeah, so I think that after all of that was over, I realized that it's a fatal disease, but if you fight, it only takes away like a year and a half from your life, you know. After that, I think that I was leading my life the way I was leading earlier, but I was not expecting it to come back again, honestly. But yeah, right after Kabir, my son was born. He was not even 1, and I got it again. Um, Now, what drives me is, of course, him. And even if I feel that, you know, if it comes back again ever, it's not that I don't live under that fear, but I feel that it's important that the drive has to come from within, I guess. And you have to be strong, and you just have to give. I always take cancer as, okay, another year of stopping, and then I'll get back to life. So I think for my journey, everyone was important, including the doctors.
Aditi, I think in your journey, like you told me,
Yeah.
and when I met your parents, they told me your husband was a key factor and Sabyasachi was the other
Yeah.
factor.
Yes.
Aditi is a designer with Sabyasachi and I think has been with him for about 14 years.
14. Yes. Yes.
14 years. And I think it was the way both her husband, because when I met Aditi's parents, they said, you know, he's the guy who walked her through it as well.
Yeah, he
And
told me treat it as
Sabyasachi.
a fever.
Yeah.
And Sabya told me only one thing I'll suggest, and one advice from me is stay away from people who'll pull you down. You just need to have people around you who can lift up your spirits. It's just a matter of time. It's going to get over very soon, and we are all here for you. I think that is it that people can do for you, but that is, I think, a lot that comes from them, you know, just knowing that nothing is changed and you're the same, and you lead the same life even if you're suffering so much right now. I think that matters a lot.
And Kabir is something that you have to look forward to.
Kabir, of course, is something, and I feel that now even if I get it 4 more times, I will not look back, and I'll fight it because I know I have Kabir to go back to. And of course my entire family. Yes, and I have you guys around, so I am not scared.
You
But
know, Aditi, I'll come back to you.
yeah.
There we have with us Sadhna Ramachandran. And Sadhna Ramachandran has been a top notch lawyer, a person who, a woman of great substance, woman educated in India and abroad, an alumnus of the Lady Shri Ram College, and very bright. And she felt something amiss in her breast. And it was possibly an astute examination which caught the disease in Sadhna's case. Sadhna was nearing 60 and you know, raring to go. And if you meet Sadhna, she was diagnosed in as a metastatic cancer. When we talk about metastatic cancer, it means stage 4 cancer. And I'd like to introduce Sadhna to you because she could tell you her story. Because if people look at Sadhna, they'll say, "Hey, Sadhna, you're alive? That's strange. I mean, where did you get the grit, perseverance, and learn to take the challenges? And how do you continue?" Sadhna, could we unmute Sadhna?
Are phenomenal. Hats off to you. You know, the way you have coped with it, it's, I mean, I can't say more, you know, there are no words that I have for someone like you. And I think you're an example to so many young women, you know. So yeah, for me, I was diagnosed, you know, I would say at the third phase of my life with grown-up children who, you know, I was looking forward to grandchildren. The family was looking forward to my 60th birthday. And then I was asymptomatic. It was completely a big surprise for me. I just found something in the left breast and I felt I should just see a doctor. And they did the mammography was normal, the ultrasound was normal. And from the hospital, I just thought I'll go home now, except that I'd taken an appointment with Dr. Ramesh Sareen. And I thought we must meet the doctor because all the technicians told me, you're okay, there's nothing, ye old age hai, some thickening, as that probably it's age. And then I meet Dr. Sareen, and I must say here to a lot of you that, medical science seems to have forgotten the good old value of a clinical examination. Most doctors are just depending on the technology report, from the radiologist, etc. But in my case, had it not been for Dr. Sareen examining every pore and then telling me, do you feel something? I said, yes, doctor. So she said, if you have an instinct, then I must do my clinical exam. And that is what led to a PET MRI, which also didn't show up anything in the breast except the bones looked bad or not so good. And then ultimately it led to a guided ultrasound biopsy of the breast and the spine. And so mine is a very unusual cancer where the primary is very small. It's not even worth operating. But the secondary is all over my spine. And rightly, Dr. Vanita said, when I first entered the hospital and narrated my story and they saw my scan, they did ask me, how did you come? How are you walking? And so that was the interesting part of my investigation. Of course, grit and determination and perseverance, we all know, are a challenge for anything, any situation in life, and especially for cancer. But I think Dr. Sareen said something very important, that cancer, the C word, gives you that grit. We all have it. We feel that, no, we must have it, we must get it from outside. No, we all have it. And when we are faced with a situation, it just surfaces in a way in which you can't imagine. And in my case, unlike in Aditi's, my, children, of course, were grown up. My husband, I had elderly in-laws. So my caregivers were nervous and they looked to me for positivity. So I was at a stage where I had to tell them, look, I'm okay. The day I was diagnosed, the next day my son had to fly to the United States. I said, you must go. And he kept looking at me. He said, for 12 hours or 15 hours, I won't even be able to speak to you. I say, I'll be fine, So it comes, and it comes, as I always feel, in, of course, two ways. The inner journey is very important. To be physically fit, mentally fit, not just for the disease, but to deal with your chemotherapy. I had, I think, I'm not remembering, 18 or 21 chemo sessions, which was, and at my age, it was a lot. And I had wonderful doctors. I mean, Dr. Sareen has been not just my doctor, but she has been, an guardian angel, as she has been for so many of us.
It's fantastic not to be able to remember the number of chemo, Sadhna.
They went on and on and on.
That shows that you managed to treat it like a journey and not bother. That's fantastic, because otherwise one says one more.
Yeah.
And just to say, okay, it's just another one. Chalo bhai, fir se chalo hospital and you get it done. It's
there were two things Dr. Sareen said. One, she said, go home and go for a walk after the chemo. So I did that. She said now, and I think it's very relevant for today's discussion, she marched me off to a nutritionist. She said, that's what you need. And almost immediately, I'm a vegetarian, so almost immediately I was able to change my diet. And I think it really helped, it really helped to find that atta and chawal is not all that life is all about, that there are so many millets and there are so many different things which give you nutrition. So I think that also gave me the confidence that, when you have a doctor who looks at you holistically, and I think that's what I would like to underline and flag. Because when Dr. Sareen used to notice that my hemoglobin was not very, it was a little on the low side. So promptly I got a list of things, none of which were medicines, on what is good for hemoglobin. And the encouragement about yoga and meditation. And then we've been hearing Sister Shivani. I love to hear, her. There are so many other ways of, mentally preparing yourself, meditation being one of them, of course. And I think that holistic approach uh, to my illness helped me a lot. And I think it's important to trust your doctor.
Yeah,
I had some very, very well-meaning people coming to me with a lot of research, telling me, this is what we found, this is what we found, breast cancer, this, that. And then I remember in the initial days going to Dr. Sareen and saying, Doctor, this is what X has said, this is what Y has said. Then Dr. Sareen just looked at me. She said, none of this is relevant for you, You have lobular cancer. And all this research is on other forms. So I feel too much information is not.
Sadhana, sometimes what happens is because we keep searching the internet for more information and it goes on, and our caregivers and friends keep saying, this is it, this is it. That creates more panic than anything else.
Yeah, absolutely.
Also, what you were saying about that a holistic approach, a doctor, I'm an older woman. There used to be a time when there was a Dr. Saab who used to come to the house in North India. I'm sure it happened in all parts of India. And he would come into the house and someone of the staff would go, or one of the youngsters would go and get his briefcase into the house and say, Doctor Saab aa gaye, Doctor Saab aa gaye, chalo, chalo, chalo. And he would walk in, he would hold the patient's hand and say, और माता जी क्या हाल है, और क्या हाल है, आपकी बेटी जो वहाँ है उसका क्या हाल है, how is your son doing, how is your daughter doing. And 50% of the sickness would vanish because of the hand holding. Somewhere along the course, I think we stopped holding hands. Like you said, somewhere along the course, when we were in medical college, we were taught that when a woman walks in, see how she's walking, or a man walks in, whether they're leaning in one direction. We don't. We put our heads down. We are all at fault. We put our heads down and scribble. I think somewhere we went wrong. And maybe the pandemic is teaching us to think again. Maybe that's a blessing in disguise, should I say? We have with us Harpreet also, Harpreet Malik, a very dear friend and known as Honey by a lot of us. And she's a two-time cancer survivor. Um, Once when she was 40, and then the second time a few years ago. And Honey has been working with Saudi Arabian Airlines, and she's been managing all the operations at the airport. And when people were sending me messages during the pandemic and said, you're working, you're working, I was looking at my friend Honey, because here she was at the airport managing those flights, getting people off the aircrafts, getting them into quarantine and this and that, organizing that the flights came back. There she was in her uniform. And I thought to myself, my God, she's working like a frontline worker, two-time cancer survivor, a dear friend. And I would think no one asks Honey, how is she doing? They ask the doctors, how are you doing? But they don't ask someone who survived cancer and is out there how she's doing. Honey, tell me, you are a staunch Radha Swami. You're a believer in God and in doing, and you counsel people, and how it was when the kids were in school the first time and then second time, and your journey. It was not an easy journey, and I've been with you through it both times. So
Yes. So Vinita was with me holding my hand throughout. Vinita and I have been friends for over 30 years now. And as Sadhana and Aditi very rightly said, God doesn't give you something that you cannot handle. He gives you the problem, but you have to dig out the strength from within. Of course, there's a great support system. Family and friends were great, fabulous. Husband, friends, children, they're fabulous. But the thing is that it's your inner strength that at the end of the day takes you through. Talking about how you face the children, first time my elder daughter was in class 12, my younger daughter was in class 5. There were days when I would get out from bed 10 minutes before they got back home from school. I would get into my uniform, I would sit down, so that when the children came home, they would feel that mom had gone for work. And
Wow.
they'd say, Mom, you went to office today? I'd say, yes, beta, but now I want to sleep. So the kids would be happy that mom spent the morning in office, whereas I just got out of bed. You know, I'm very, very, very prone to nausea. I could not eat throughout my chemotherapy. Now, when I counsel people, I tell them there are good days, there are bad days, make the most of your good days and, you know, just go through your bad days. And, you know, when Colonel Pant told me that he's the one who diagnosed, he sat there and he said, look, you're brave. You have cancer, let me tell you. But you know, it's all of us go through the denial stage and the next stage, and then it was Denita and it was other friends. So nutrition is very important. I could not eat much during my chemotherapy. But as Aditi says, it's a year or a year and a half that you have to sort of strike off your life, and then you need to bounce back. And you bounce back with a vengeance because you change as a person, your outlook to life changes, you love yourself, you love the people around you, you appreciate everything that nature has to give you. So these are the positives of cancer. You know, it changes you as a person. Second time when I got diagnosed, you know, again, it was just a few months before my daughter was getting married. And Vinita was the one to give me the news, and it was a long story, but second time has its advantages and disadvantages. You know what you're going to go through, but you know, sometimes you're a little older. And and then, you know, society gives you so much, and then you learn to give back to society. I'm a life coach now, and I specialize in coaching people who are going through cancer. So, since the topic of today's forum is the nutrition, uh, during chemo, whoever can eat well must eat well. But after chemo, you do need to change your eating habits. You know, I'm a pure, pure, pure vegetarian. And, you know, I have to find ways to get my protein. I have to find ways to get my yoga, my exercise, my meditation. All this is very, very important to keep you totally balanced, feeling good. So that's what it is. And I totally resonate with what Sadhna ji and Aditi said. All the points, you know, that they made were exactly what I felt when I was going through my cancer. I worked through both my treatments at the airport, which is a very demanding job. I just completed 40 years with Saudi Arabian Airlines. And I sometimes was working at the airport with the chemotherapy ball in my pocket. There was a ball in my pocket, and when I would, you know, go to the aircraft and come back, go through security, the lady who was frisking me would ask me, "Ye kya hai, madam?" And I would say, "Ye chemotherapy hai." So she'd say, "Oh, acha, 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 aap jaiye, aap jaiye, aap jaiye." So I actually had a PICC line and a chemo ball in my pocket, and I was at the airport working. And so, so that's it's how it went for the second time, and that's what I have to say. I just have to say, pull the strength out. And another thing that I'm a strong believer of is that all of us need to sit down every morning and have a positive dialogue with ourselves. There are going to be days when we feel that we are pulled down, we don't feel as good, you know, someone said something, someone did something. Just sit down and have a positive dialogue with yourself, because you are your best friend. You are your well-wisher. And you stay happy, you keep people around you happy, you know, try to just give to society, because when you give to society, you get so much back in return. You then realize how fortunate you are compared to so many others.
I
So
know
giving back to society is something.
Harpreet and Sadhna are giving back to society in many ways. And Aditi, I think, is keeping her creativity alive. Am I right, Aditi? So that must be bringing a lot of positivity in your life, Aditi, the creativity.
Yes, of course. I mean, there are, I think each and every one of us have ways to channel their negative energy, their positive energy. And I think that we have to keep a balance between the two. I mean, life, I think for us also, it was more like, I think that in COVID, a lot of people had the sort of experience that we go through when we have when we had,
Right.
because everybody looked into what their life is holding, what should be held close to them, and what they love more. And I think that, um, because we are talking about health and all, and as everyone here rightly said, that I think the little bit that we have no control over is where doctors come in. I mean, we can't really help that. But a lot of it where we actually have control over is our diet. And that every day when you eat something good, for a cancer patient especially, you feel that, in your own way, you're pushing the disease away from you. I mean, if it comes back after that also, you can't really do anything because you don't know in first place why it came to you. So I feel that whatever little bit that we can do, we must do.
I guess optimism is a attitude, right?
Of course, of
Optimism
course.
is, and is something you keep developing. It's not so and so's optimistic and so's pessimistic. I know in the morning when I wake up, I don't have any of this. I have never dealt with cancer personally, other than with my brother, but I have never dealt with it on a personal to me. But I know that when you wake up in the morning, there are good days and bad days for all of us.
For everyone, yes,
For all of,
exactly.
and if I think I'm going to be positive, I'm going to eat right, I'll do all the good things, I start feeling better with myself. I
Correct.
start doing my yoga, I do my exercise, the endorphins, all the various positive hormones run through my body, and I say, ready to go again. So I'm sure that gives us a lot of great healthy eating gives us great.
Yes.
When you eat unhealthy, you feel like a sloth also. I mean,
Yeah.
honestly, you do.
You do.
That
Just
saying,
the other day, Anjali
"फल
was
की
saying
इच्छा
that
मत करो," it's the same thing. That you have to
I'd
keep
like,
doing things for your body, for your own health. And the moment you start doing that, I feel that, the entire family also, you will see little changes everywhere. And, I think that accumulatively brings a lot of positive energy to you, and you just feel that at least you did your own bit. And I think that's very, very important. Diet is very, very important. And I'm beginning to understand that with age. Of course, COVID, we all had time to read about all these things and look into our health. And I think that is the only way forward, I guess, where we have control over.
Dipali has Shubham joined us, and how are we for time?
I think now we should
It,
move on because yes,
yeah,
6 o'clock is the time when.
yes. So thank you very much, ladies. And it's been a great pleasure to be connecting with all of you. Uh, I'm so inspired by each and every one of you. So inspired. And if there are people I want to look up to you, it's you women. And congratulations to you on International Women's Day.
Thank you.
Aditi and
Thank you.
Harpreet.
Thank
I
you.
Thank
can't,
you.
Thank
Thank
you.
you.
Aditi and Harpreet, it's such a pleasure to see both of you after, a gap of a couple of
Yes.
years. And you both are looking lovelier than ever. Lovely to see you as well, Sadhna ji. The human spirit is stronger than the human spirit is stronger than anything that can happen to it. And you three ladies are a perfect example of that. Your experiences really inspire us. And it's all about focusing on the fight and eating right and not about the fright. So, really thank you so much for the questions, and lovely for your inputs. Thank you so much. Dr. Bhavna Sirohi, I'm going to move on. Dr. Bhavna Sirohi is Senior Consultant and Lead Medical Oncologist at Apollo Proton Cancer Center. She will take us through the diet session where she will highlight the kind of diet one should intake to prevent cancer and improve outcomes. Over to you, Dr. Sirohi.
Thank you so much, Dipali, and I must thank Colonel Pant and Dr. Sareen for organizing this session, because today being International Women's Day, all of us have done something or the other in our respective institutes, but I think this is the most important session of the day. And it was a pleasure to hear Aditi, Sadhna, and Harpreet tell their stories as cancer conquerors. It gives me great pleasure to invite my panelists for the session. Shubham Pant, he's written a book called, actually, I must show this book. I have read it, Food Matters, the role your diet plays in the fight against cancer. So, you know, it's the reason I love this book is because it has references. So it's evidence-based, you know, we have a logical scientific mind. It has personal stories and it's practical. And Shubham has taken inputs from specialist people, has taken input from patients. I know, Shubham, you love music and you want to do the best for the patients and diet. So I think it makes you a completely holistic person as well. So welcome, Shubham. My second panelist is Mrs. Menon, Mrs. Prasanna Menon. Welcome, Mrs. Menon. Mrs. Menon has contributed recipes to the book as well, and we will delve into that in detail. And we have Anjali Sapra, who also features in the book and is a cancer conqueror as well. And lastly, the most important person, Dr. Sareen, who we know, I mean, I've known her for a long time, as we all have, and she's one of the, she's a surgical oncologist, yes, a breast oncologist, but breast surgical oncologist. But what I love about her, that she treats the patient holistically. You know, whenever I've had a patient we've treated mutually in Delhi, she takes time, she spends hours with patients trying to explain why one modality is better than the other. And, you know, hats off to Dr. Sareen, you're still so passionate about everything. I love this, you know, at conferences, we still talk.
Oh, she's asking me to start my video.
Okay.
Yeah.
So, so Shubham, I'm going to start with you. So I want to know what made you, I know there's a personal reason as well. I just want you to talk us through as to what made you write this book. I wish I had written this book, you know, it's so.
I'm sure you could have, Bhavna, and thank you so much for the invite and for the stories that, you know, heard, you know, amazing stories, obviously. And, you know, I had the pleasure to incorporate these stories, some of these in my book. But Bhavna, as you know, you were in the UK. I right now practice in Houston, Texas. So we have time in a way to talk to our patients about diet, about other things when they come to us, in addition to therapy, because of, you know, Dr. Pant, who's my dad. You know, he calls, you know, he's also very passionate, just like Dr. Sareen. He called me, Shubham, you know, ye patient ko hai, you know, what do we do? Can you help us on this? Or, you know, can you help with one or the other? So he's also very passionate about patient care. So whenever I used to talk to people, engage with them in India, friends, family members, you know, some, you know, that my dad requested to talk to, nutrition was really not in the, you know, was really not talked about essentially. And the other thing was, when I really looked at the data on literature on nutrition, there is some literature on what you can eat when you're in the US. So, you know, a lot of it is though foods which are not available in India, or people just don't eat culturally in India. And I thought there was a need for that. And I just used to, you know, like writing in my medical school in Delhi. I'm from Delhi. I went to Maulana Azad, and so I just started writing on weekends, and it kind of morphed into this book. And then I talked to amazing people like Mrs. Menon, Anjali, you know, Neeti, and then kind of, you know, got these great stories. And I just thought, you know what, you know, it was an honor to kind of talk about these stories and tell these stories from a different perspective. And I'm an oncologist. I see this day in and day out. Right. But patients are very, patients are, you know, they you know, like just listening today, right? Just listening to all the stories and everything. It's incredibly, it makes you want to be a physician, right? Go there and work every day. So, you know, those are some things which pushed me to write the book.
I think you're absolutely right. We are very lucky in the West, like you're at MD Anderson. We do have time. We can spend hours and we can discuss diet. Dr. Sareen, how important do you think diet is, and how often, I mean, do you discuss diet with your patients? My experience is, you know, every single patient asks about diet. Unmute yourself. I'll unmute yourself.
Paneling the session, for being the moderator. You know, whether mostly after the treatment is finished, every woman comes back, because while they are taking the treatment, they are so involved with the chemotherapy, side effects, coming to the hospital, going back, having nausea. And when they finish the treatment, now they just have a vacancy, then they come back and ask you, doctor, what can I do so that it doesn't come back? What can I eat? So every woman asks this question, what can I eat? And now more than ever before, it's being recognized that diet plays a very important part in preventing and in also improving the outcomes after the treatment. The West, I have done studies on thousands of patients where the diet was changed, or where a diabetic person was asked to control their diabetes much better than the other group where it was not. The outcome for the breast cancer improves. And this we know that the mortality on the obese people for breast cancer is much higher than if you're not obese. So diet, obesity, exercises play a very important role in preventing cancer. And I think we as doctors treating any cancer, but we are going to talk about breast cancer today, I think it's important that we be educated ourselves as to what we should advise to our patients, and then we should take diet counseling as a part of the treatment, whether it's chemotherapy, radiation, or surgery. It should be also written down, diet and exercises. And I have today, just for your this one, I have today on this International Women's Day gifted 50 books of Shubham Pant to all my oncologists in the department. And I told them personally, I got up from my seat, went to their room, and I said, you must read it. It's scientific. It's, it's got references, and let's sit down and make 2 pages that we can give it to every patient and then talk to them. So, I think it's improving outcomes, the book.
Thank you, Dr. Sareen. Anjali, as a patient, so how important was diet, and what tips, we have a lot of patients on the forum today. What tips can you give to our patients? Some of them may be on chemotherapy, some of them may be, further down in the journey. So what tips could you give our patients?
Unmute yourself, Anjali, please.
Thank you so much, and happy Women's Day to everybody here. So I think diet is really important when it comes to life, actually, not just being a patient or, life after cancer, but I think nutrition and what you put into your body is really, really important. And I think it's not just food for the body, it's also food for the soul. I think both things go hand in hand. But primarily speaking, we are here, undergoing chemotherapy. I was very conscious of the fact that whatever I put into my body had to provide optimum nutrition. Because a lot of time when you're undergoing chemotherapy, you're drained, you don't want to eat, you can barely put a little bit inside your system. But consciously, you have to be mindful of the fact that whatever you're putting in your system has to provide you the strength and the optimum nutrition to fight the disease and, help the medication do what it's supposed to do. So whether it's a protein-rich diet or something to boost your iron and, therefore your hemoglobin, every bite that you eat must make you strong, must make your body able to fight the disease. So that was one of the takes I had from, when I was undergoing chemotherapy. Post chemotherapy also, I have really changed my diet. I go in for absolutely freshly made food, home cooked as much as possible, have a very balanced diet, make sure that there's enough protein that I'm putting in, whether it's breakfast, lunch, or dinner. And I think Indian foods are great for that. You can have your chila in the morning, you can have sprouts, you can have, all kinds of things, dosa. So that's, breakfast taken care of. Lunch, of course, for a vegetarian, you have to have your dal, you have your sabzi. dahi, so basically our Indian meals are very, very balanced usually. What I have done is actually go in not so much for wheat atta, but I make a mixture of millet atta, 2 or 3 different kinds of millets. So I've tried to, go gluten free as much as possible, and I find it has really helped me in a lot of ways. For one thing, it helped me lose weight after chemotherapy because I put on a lot of weight. I mean, during chemo, I was always hungry. I think it's because of the medicines that you have, the steroids. So going gluten-free really helped with that. I've given up white sugar. Our Indian kitchen is actually a powerhouse of medication. So, I start my mornings with the haldi water, with ajwain, haldi and kali mirch ka pani. I have a lot of fresh foods like fresh green chutney, tomato chutney or something, anything that is not out of a bottle. Something which is not out of a bottle.
Actually, not
Yeah.
eat processed foods actually.
No processed foods, no white sugar. I mean, we have good, we've got raw sugar, we've got bura, we've got khand. We have so many substitutes. We can even use fruit juice. I cook a lot. So when I make cakes, I actually use fruit and dates as sweeteners rather than sugar. And I also substitute with, ragi atta, jowar atta, bajra atta instead of using maida. So, there are lots of substitutions one can have. Another thing I've given up is dairy and dairy products. However, I do have desi cow milk. I make dahi out of desi cow milk. So it's, I think that has also been one change. I hardly have paneer. I don't have eggs. I'm a non-vegetarian. So I have a lot of fish and seafood instead
Great.
of chicken. And
I'm going to come back to Shubham in a minute, asking about what we should do. I'm going to come to you, Mrs. Menon. You have traveled globally all around the world, and you were a caregiver as a 17-year-old, and then you've been a patient as well. So based on your experience, you've given some amazing recipes in the book. So could you share some of your thought process in making these recipes and designing some of them?
I'm listening to all you awesome ladies, and I'm terribly in awe of all of you. Compared to all your experiences, mine was a very simple, uncomplicated, easy journey, I should say, because I was diagnosed early. I didn't have too much trouble. Of course, during chemo, I had the same troubles everybody else has, feeling very, very sick and tired in the first week. My video, unfortunately, is not working properly, so I'm going to keep it off, if you don't mind. You'll only see my messy table otherwise.
No, that's fine.
So I'm sorry you can't see my face. It's not that great anyway. So anyway, to get back the bit, I realized very early on during my first chemo itself that since I cooked for myself, I would have to organize my food according to the times of the chemo, meaning, it was a 3-week cycle. The first week you're so tired and so all you want to do is sleep. I didn't have children to take care of like some of the younger participants, and I didn't have a profession.
So Anjali talked about, this is a very common question in my clinic, sugar and dairy. So every patient, asks us, should I cut down on the sugar and should I stop the dairy? So what would you advise?
Yeah, so I think one of the really good things Anjali said was you can just, Indian food is full of, really, great nutrition. And the issue, what we see also is, Bhavna, one of the reasons also I wrote the book, I forgot to say, was that people always look for the exotic stuff. I'm going to eat that exotic fruit, or I read it in some, these are clickbait headlines, right? So I read in online, somebody sent me a WhatsApp message on saying, hey, look at this fancy thing from like the Amazon jungle or something, right? So the issue is it's very hard to be, mundane. It's always, it's better to be, to eat something sexy, right? So the mundane stuff is hard. And I think that's what we should stick to. So there's a saying called 100 roads to Dublin. What that means is it doesn't matter how you get there. So food is very personal for everyone. So what I may eat is different from what you may eat, is from a different Anjali, Dr. Sareen. It's very personal. So we kind of try to make our food choices. So, so in the book, we're not prescriptive about what you should eat, eat this or don't eat that and everything. But the big thing is, obesity, huge. So whatever you do to lose weight, whether you go gluten-free or whether you cut down on the carbs or you do something, that is going to help you. Adding on exercise to your daily routine. So all this sounds really good, but when we really get to doing exercise, you kind of find 10 things, right? I say, I just kind of came from work. I'm, so tired, and so, all these things are hard to do. So first we should focus on the mundane: lose weight, exercise. Easy to say, everybody says it, right? But hard to do. So the book tries to tell you why you should exercise. There is data, like you're saying. We actually quoted from all these journals. It's written. I wrote it like I would write my scientific paper, but I wrote it from a more of a human element, because that's the way to tell the story. But those are the kind of the main ones that we should be really looking at. Is Indian food has it all. You don't need to go out, to get that fresh fruit from Thailand or something, some exotic fruit. Indian food has it all. You just have to look at what your journey is and what your relationship with food is. And that's very personal for everyone. The big thing though is sugar is important, I think, because it's not the sugar that you put in your tea or, one, if you put it, that's fine. You can use honey or something else, but it's the hidden sugars are very important. So, when we eat, like, the Chinese food, all that soy and everything, that's all sugar. Especially the colas and everything, all those drinks which we drink, they're all sugar, and there are a lot of sugar. So a can of cola can have 32 grams of sugar. That's 8 teaspoons. Like, who puts 8 teaspoons of sugar in their tea? So the hidden sugars is what we don't think about. The sugar that we can see, you can. So that's the important part. So you can do, you really have to make an attempt to look at the label, like we say, about what you're really putting in your body. And it's harder in India. I try to look at, when I get from the Indian store here, I try to look at the label. It's really tiny, telling you about the sugar and everything. But I personally don't eat anything unless, which comes in a package, unless I read the label. And I know exactly how much sugar is going in there, how much carbs am I eating. So that's very important to me. So I think that's some of the simple things are the hardest to do. But if you just think about, if you, just 1 week, just write down what you've eaten, and then, or write down every day what you're eating, and at the end of it, just look at it and see, where can I really make changes? Not drastic ones, but little ones that you can keep up, because it's not like 2 weeks, this, whatever the 2-week diet is, there are thousands of them out there, right? It's not that 2-week diet, it's a lifestyle change. So you should do something which is not that extreme, that you can't, come back to, right? You have to make that lifestyle change. So maybe more gradually is better.
And, in your book, you talk about, the rise of the Western diet. And I have a feeling, that probably is leading to increased incidence of cancers in the urban areas, urban and semi-urban areas. We're seeing more of colon cancer. We're seeing more of breast cancer, which are lifestyle-related diseases. I mean, do you think that is the case?
Absolutely, Bhavna. So as you know, first colonoscopies in America and the West were done at 50 years of age, when you turn 50. I'm actually going to turn 45 this year in August, and I'm going to get my first colonoscopy, because now they say it's 45 years of age. And
Yeah.
why is that? Because we're seeing younger. At Anderson, I never used to see young patients with colon cancer. When I started my, even 10 years back, they used to be 50, late 50s. We're seeing kids in their 30s, some even in their 20s, and show up with colon cancer. And all these are related to the gut, basically. And a lot of it is due to obesity. A lot of it is due to, again, processed foods, red meats. Those are the ones which really we've seen they're a higher risk, essentially, for that. I was joking. I was talking to one of my friends. His mom is like 83, and she had some issue, and they did a colonoscopy, and he said she's a vegetarian, lifelong vegetarian. Like the guy came out in America, and he was like, "My God, that's the cleanest colon I've seen." Not to kind of make it look so odd, but it's just that. It's just all these things. Food, especially when we're taking this, takes a toll on us, on our body. So that's you're right. That is very important, and it is changing in the West. Definitely, we're seeing this epidemic of young cases, young patients with cancer. And it's happening, obviously, now it's gone to, India and other countries, essentially.
So you're absolutely right. I'm seeing late 20s and early 30-year-olds with colon cancer, triple negative breast cancer. Dr. Sareen, one of the things you said was, a lot of oncologists say that, don't have raw food during your treatment, during your radiation, surgery. So what do you advise normally? Because when patients come to you, those who are on chemotherapy or post-chemotherapy for advice, because, you are absolutely right. A lot of oncologists still say, don't have raw food during your
Yeah.
treatment.
Yeah, actually, it's been going on for almost 25 years. I know very senior most oncologists, he would write down and say that don't eat anything raw. And so women will come to me and said, we've been asked not to eat kheera and gajar and muli and all those, and even the fruits, And I thought all of them had this essential amino acids and essential vitamins, and they're very important, fresh foods and all that. So then when we read through it, we came to know that it's not the raw foods. It's that if you don't, a patient taking a chemotherapy is more prone for infection. That we tell everybody that your counts will go down and you're more prone for infection. And one of the roots of infection is the GI tract. And so if you don't wash your fruits properly, and if the skin is infected, that we know that, the grapes and the other things where the dundee is, it may be infected. So you just need to be extra careful to wash every fruit and vegetable. And to my mind, one can eat anything and everything. And in fact, the fresh fruits and vegetables, cooked or uncooked, both can be eaten. I'm sure Shubham can correct me. So now I think more and more medical oncologists and other oncologists are now getting aware of the fact that it was the infection part when you said don't eat raw foods and raw. So out there, if there are people who are taking chemotherapy, or if your friends and your relations are taking chemotherapy and other things, to my mind, you can eat, and in fact, you should eat fresh fruits and vegetables, cooked or uncooked, as long as they are washed properly. And washing could be twice, or it could be with an antiseptic. But just like we learned during the COVID time that the fruit should be and the vegetables should be washed and all that. So there is nothing called you can't take raw foods and raw vegetables.
So I agree with you, Dr. Sareen. I think on chemo, my advice is always, hydration, nutrition, exercise, and hygiene. Hygiene has to be oral, personal, and food hygiene. So I think, Shubham, would you agree that, I've never stopped patients from eating raw food. I have always said, just make sure that, you clean it well. And, and in fact, they give you the most essential vitamins and minerals.
Yeah, I completely agree, Bhavna. There's really no data to say, this is an old, exactly like Dr. Sareen is saying. This was in the beginning when we really did not know how things work. In a way that people were saying, oh, if you eat this, it would be really, really hard for something in the food to really go through your gut to give you an infection. These bacteria already are, people don't realize we have bacteria, millions of bacteria in our gut already. And what happens is when our immune system goes down, they just translocate into the blood. That means they go into the blood. So it's not that the food is bringing this, those bacteria are already there in the gut. So, and the other thing is, when you, as Anjali might tell you also, that when you are going through cancer therapy, your taste buds change. Maybe you like sweet, some people like salt, some people like have the metallic taste in the mouth. It's anyways hard to eat. You're getting nausea. It's anyways hard to eat. And on top of that, if people tell you don't eat this, don't eat that, don't eat this, then you lose weight. And if you lose weight, if you can't tolerate the chemo, then we'll have to dose adjust the chemo, or skip a few doses and everything, which is maybe, in the bigger scheme of things might be a little bit more challenging than than just keeping your nutrition. So it's anyways hard to eat. I never stop my patients on whatever they want to eat. I always tell them that, even I tell them, if you want eat something sweet, you can have like a dessert or something on the time, but don't just eat like gobbles of like sugar, right? No, don't start drinking the colas or something. So that's the only thing I advise them against. But I always say, if you want a dessert, maybe it'll taste better, right? If you have I don't know, rasmalai or rasgullas are my personal favorites. It's okay to have a little bit. It's okay. It's everything in moderation. So, but you have to get through that chemo. So whatever you can eat, because everybody, again, changes their, and then if you try to be more restrictive on patients, that's the worst thing, I think, for cancer therapy.
So Anjali, most of my patients, my ladies with breast cancer would gain, at least 3 to 5 kilos, I would say, on an average during chemotherapy, mainly because of the medicines we give them and later on tamoxifen. So you were able to successfully lose weight and change your diet. So how were you able to do that?
Bhavna, it took a little time, but I think once the effect of the steroids wears off, it's a combination of eating right and exercise. And to my mind, the easiest exercise anybody can do is walk. Just walk. And yoga helps, of course, stretching, because you're a little bit restricted also sometimes during chemo. You may have a lot of pain. I had a lot of pain because of the booster doses I used to get, about 4 shots a week, because my hemoglobin used to plummet. So 4 shots of boosters a week. And the doctor also said, he's saying it's going to get time, it'll take time for the bones to heal after the treatment. But yoga really helped, walks really helped, and of course eating right. I love fruit, I love fresh salads. So I think eating more of those in quantity, going in for no fried foods at all, no packeted foods. And I think above all, one important point I would like to make here is that, we should all try and eat seasonal and local.
Absolutely.
And the best thing one can do is, again, like Shubham said, don't search for exotic ingredients. It's all right here. Just eat seasonal. We've got amazing vegetables in India, green vegetables of all kinds. Winter, you have all your different sags and palak and methi. So just go for local food, seasonally grown, and which is just available in your backyard. And try and eat home cooked, because you know exactly what you're putting in.
Yes, exactly. So eat local, think global.
Yes, and eat out of your own kitchen, because you know exactly what you're putting into that. You know how much fried food that there is. And there's a lot you can substitute. There's a lot of ways you can tweak food in order to make it healthier, with less oil, because that's in your hands then.
Absolutely. And diet is something which is so personal and so something that is so easily doable.
Yes.
But I don't know why we don't do it. And I think it just needs a mindset change for us to do it.
Mhm.
Dipali, you're policing us here.
Sorry?
So you can tell me whenever we've overshot and when we need to
No, we still have another 5 minutes.
Dr.
Bhavna, can I just come in there? I just want to tell everybody around listening is that it's not just the corticosteroids or the medicines, because sometimes with an AC, with certain kind of chemo, we don't give them steroids. I tell you why women put on weight. Because when the relations, is good to have a support system with your relatives and your husband. But what happens is they tell the women, don't get out of the bed. Just sit there. They're served food on the bed. They're asked to rest. You need rest. You don't need to work in. So when they are taking rest and not even doing their normal activities, they tend to put on weight. Obviously, you're eating more because you're being looked after very well and you're asked not to work. So I think it's again our duty to tell them, please give space to the women to think herself. Let her get out of the bed. She can even go to the kitchen and cook. She should do her own work. She must walk up to the dining table, sit on the dining table and eat, but do not discuss about cancer. You have any question, ask the doctor. So the ambience around the table should be happy. While you're eating food, just concentrate on the food, because then, the nutrition also seeps in. So I think it's not just the medicines alone. It's because they want to look after you, in a good sense. But obviously, it sort of adds to the wrong weight kind of things.
I agree with you completely. I think we in India are very good at looking after, anybody who's sick in the family. So that's why I keep stressing during chemo that continue working, don't let this stop you. So I think that's very important. I'm going to start with the questions actually, because I have about 7-8 questions and not sure whether we'll be able to answer all of them. So Shivani wants to know, chemotherapy takes a toll on the bone. How does one rectify? With what medication and foods? Shubham, do you want to take that?
Yeah, so there are different kinds. So what I think what Anjali was referring to is sometimes we give growth factors. So after, if your white count is down or something, we give growth factors, and they cause, because they're stimulating the bone marrow, so they cause pain in the bones essentially. So you can do exactly like what Anjali did, is kind of this stretching exercise and everything. We can give something called NSAIDs, which are like medicines like ibuprofen, brufen, and everything, which now we know, or naproxen, which actually can help with the pain now. So there's been a study out there saying giving naproxen for 3 days. And Anjali got chemo before, but now we actually just give one shot, which lasts about 11, 12 days. And that also gives this bony aches and pains. Then there are also bony aches and pains concerned with if the disease goes to stage 4, metastasizes to the bone, let's say from the breast or with other cancers. And that's a little different. Sometimes we can give some bone strengthening agents that we give for osteoporosis. Or we can give radiation or other things. So it just depends on what kind of disease it is, the stage of the disease, and what we're trying to achieve here.
Absolutely. And nowadays with post-menopausal women, actually we give this drug for 3 years routinely, and I think exercise will help you put the calcium back in the bones as well. Yeah. And so there's another question: a reason to leave dairy or wheat?
I can take that or something. So I think it's an individual thing. I think it's overall, the data is not there to leave anything. I think so. It just depends on what you're.
Yeah, sorry.
Some people, like, I think their body changes. Like Anjali is saying, she kind of gave up wheat and everything, and she felt clinically better. It's just everybody is different in a way. There's no really, carte blanche that you can tell for everyone. It's basically what individually, what you're comfortable with. But that doesn't, as far as the rate of recurrence change. So let's say Anjali lost weight because of that. So that improves her outcomes essentially. That means that decreases the risk of the cancer coming back. So that, kind of, especially in breast cancer, it's very important that these studies have been done. So it just depends on, again, that kind of concept of, whatever you can do to stay healthy, kind of exercise, walk half an hour every day, or, whatever your exercise is, or use something to lose weight or maintain your weight is important.
And I think there's a comment. One thing that cancer teaches you is how to be high on haldi shot. You take haldi shot as well, Anjali, isn't it? I mean, I take it as well in the morning. I don't know.
I do. Every morning, haldi and kali mirich, and I think little ajwain also.
So yes, Dr. Sareen, you take it as well. I put adrak also in it.
I don't take it, and I don't believe there are lots of doctors over there, the oncologists, who advise expensive curcumin capsules. They are expensive. And I do not know if they have a great benefits in relieving your side effects. Of course, haldi, we know from time immemorial that it's a antiseptic, when it used to be put on the wounds and wounds used to heal. But whether it plays a very important part in your diet system, that you should be taking expensive capsules. But yes, healthy in general, we put it in every vegetables that we cook, whether it's dal or vegetables or isn't that.
Dr. Sareen, I
Bhavna, just
the kachi haldi, not the kachi fresh haldi.
Same. I agree.
So the thing is, so I just wanted to reiterate what Dr. Sareen said. She said a very important thing and a very, I think, critical thing is, we've used haldi is used in India for time immemorial. Centuries and centuries of food is cooked with it. So cook with the food, just like Anjali, you take it in the morning. But what happens is people prescribe these really expensive supplements, chai latte in America, there's all, turmeric chai lattes, and people just drink them once a month and they think, they've kind of achieved, so that's one of the main things, is that it's not that those supplements are, you don't know what's in those supplements. So it's very, supplements are really challenging. So if you can, it's anything natural, you put it in your food, you kind of have it in the morning and everything. But what Dr. Sareen is saying is very important, because even in America, people prescribe these supplements. And what happens with these supplements is that the turmeric supplements, it's not easy. It's very hard on the gut. So it doesn't get absorbed well. People get a lot of GI problems. It's very challenging in America. About 3 years back, there was an unfortunate case and somebody was trying to take IV because it's not absorbed well. So they say, oh, it's nano bound or something, they put a little sexy kind of twist to it. So those are the challenging parts. You should definitely take it, and that's in the Indian diet. So you don't even have to make an effort. Or you do it like what Anjali is doing in the morning. You take it, kind of as part of your food. But having supplements or somebody prescribe these expensive supplements is definitely not the way to go. It's basically to be incorporated into your diet. as a regular day-to-day thing that you do.
So
Absolutely.
Shubham, can I also just add a little bit here? You know, again, I feel like Indian cooking is really a pharmacy. Like we always have condiments with our food. You know, you have your hari chutney, which is again just pure immunity boosting. Then we used to have, the adrak in the nibu, which is again immunity boosting. So you have all these little things which go with your food. Avla, you have an avle ka, chuka hua avla. So these are all things which add to the taste of your food, but at the same time, you can just do them at home and they just, increase your immunity. Like how?
Absolutely. I think that's a very, very good point. Our diet is so diverse and is so amazing, especially the vegetarian diet. And so there's one question on, does dairy increase estrogen level? One of the reasons for breast cancer. So, WHO actually showed that, India is producing, say, 1 liter of milk, but you're consuming 100 liters. So I think that is the reason why, what Anjali was also saying, you take the A2 milk, Jersey cow, which may be better. But again, the quality of the milk, if you
no, I take Desi cow. Bhavna, Jersey cow milk is not A2 milk.
So sorry, Desi cow, sorry.
Yeah.
Sorry.
Yeah. In fact, Jersey cow milk is more harmful than anything else.
So it's Desi cow, not Jersey cow. I'm sorry about that, Anjali, Desi cow. So do you have to comment on that, Shubham? Is it because maybe we are giving growth hormone to increase the milk production? That's why, that may be the reason. Yeah, you're right.
Yeah, I think potentially, but dairy by itself is not bad. I think it can be taken. It just has to be taken in the context again of, your whole food, essentially what you're doing. And like Anjali saying, she found out her own, sources of food, where she gets it from. That's very important. It's the hardest thing to do, right? Trying to figure out where your food is exactly coming from, where your milk is exactly coming from. That's the hardest. So I think most of it is in the processing, not so much the food group by itself.
Great. So one last question we'll take is, I've been diagnosed with papillary thyroid carcinoma and breast cancer. I had undergone surgery and radiation. What diet should I take being a vegetarian so that I get the required nutrients and also remain fit? I think you need to read Shubham's book, beginning till the end.
I would say I would agree. I'm just kidding.
Rifat, I will give you, I'll give you his book free. You are coming for a follow-up. I know you. So just come, take the book and read it and you will get all the answers. But we have seen breast cancer and thyroid cancer together in a number of patients. Actually, when two cancers happen, I think thyroid is the commonest because thyroid is a common cancer these days because it's increasing in incidence, whether it's because of the iodinized salt or whatever. But thyroid cancer, isn't it increasing, Bhavna? And that is why
I'm seeing more. I think somebody's asking what's the name. I think this is the book, Food Matters.
You can get it from Amazon also.
So what is your favorite recipe, Shubham, in the book?
I don't have a favorite.
We're all
To tell you the
rooting
truth,
for
it's
that.
also good. It's no, they're so like good ones. Some of what Mrs. Menon has contributed. Those are some of my favorite ones. But there's a lot. So Pushpesh Pant, who's an authority in Indian food. He's given some really interesting things that you can do with grains. There was a chef here, Anita Jaisinghania. She kind of gave her some of the recipes. So they're all, it's like choosing your kids, right? Like my daughter say, who's your favorite? I really can't say. they're all kind of my favorites in different senses. So
Anjali, what is your favorite?
Bhavna, I keep tweaking. I'm a big foodie, so I keep tweaking recipes and I come up with my own recipes, and I keep substituting.
Can I just say, during the COVID time, because I have time, so I've been watching the recipes. I'm not a foodie and I'm not a good cook, but I must tell you, every recipe has adrak and lasun, which you agree, Shubham, and you were saying, Anjali, is good for health, it's good immunity. So every curry thing, every recipe adds it. So, and the nimbu. You marinate anything, it's adrak, lasun or nimbu, So I think the Indian, as Anjali said, it's a pharmacy, it's a good pharmacy, the Indian food and the Indian recipes. So you know, that's where I think we are on a good ground in India, because we don't take much of processed food, which is not good. We don't take much of canned fruit, which has a lot of iodine. You know, I mean, in the West, we don't take a lot of those processed cheese and tons and tons. I do not know if that is good or bad. Shubham, you can correct me, but it's good that we are not, you know, much with the processed and the canned foods.
Yes, that's true.
Shubham,
I'm going to say,
can
I know,
come
I know
in
we
for a
probably,
minute?
sorry.
This Prasanna here. Can I come in
Oh,
for a minute?
hey, Ms. Menon, sure.
Hi. Yeah, sorry about the video, but since you like my recipes, I have a ton more for you, which I
Oh.
think I could do for your second book.
Yes, I mean, you could.
Our second edition, you're right.
Yes, I mean,
Yes.
Shubham is joining on Monday next week as well, Shubham, for our global support group meeting. We normally have, so maybe Mrs. Menon, you could join as well and give some recipes.
Oh
tips.
dear. I think
Yeah.
I could send them to you in writing, because where I live, obviously the Wi-Fi is not very good and we've been having power cuts. East Delhi is really bad.
Mrs. Menon, I suggest you come to our clinics and please give us voluntary work on nutrition and on recipes. Patients would be really, really happy.
I'm happy to do it online. I'll write you everything you want, but coming, I'm a little nervous because of COVID and, you know, other things as well. I don't think you really need to see me personally to try out my recipes.
Thank you, everyone. I think we are coming towards the end, Dipali. Thank you so much, Shubham, Anjali, Dr. Sareen, and Ms. Menon. So it was very, very informative. Do you have any last pointers you want to add before we wrap up this session?
Yes, I have
a
one.
word?
Sorry, go ahead.
Yes.
Yes, Ms. Menon,
Yes,
please go ahead.
before I go, I've been listening to all of you, and I think as far as nutrition is concerned, we should stick to our normal foods.
Yeah.
Just tweak it a little bit. If you know, add nuts to your vegetables, add dal chutneys. You know, South Indian cuisine has a lot of them. So if you just add a tablespoon here and there, I think you'll find you have all the protein and the balance that you require.
Thank you. Shubham?
So I have one last one. So I just want to thank you, Bhavna, and I just want to let everybody know that you know, I've known Bhavna for quite a few years. She's a highly accomplished doctor, and more than that, she's a very, very good human being, very passionate about the care for her patients. And you know, people ask me from here when they call up, they say, you know, at Anderson, whom would you recommend? Whom? And I was like, yeah, go see Bhavna, go see Bhavna, go see Bhavna. And now she like went to Chennai.
Right.
So Delhi's loss is Chennai's gain. But that just now I don't have somebody to send people to Bhavna. So I hope you're doing well, and I know you must be doing great job in Apollo in Chennai. So congratulations for the move,
Thank you.
and thanks for hosting this.
And also, in addition, Bhavna is also a holistic oncologist. She does a lot of support group meetings talking about diet and exercise and yoga, and even telling women about the side effects of tamoxifen on the skin, on the vagina, on the hair, and answering them. So she does a lot of support group meeting once a month, once a year, once a month, maybe.
We do it once a month, third Monday of the month, 6 to 7
Which
p.m.
I just love that these people that we treat, we owe it to them, you know, to have their complementary therapies.
We've had patients from London, Boston, Tanzania, Kenya, China join in, which is amazing. The Zoom has made it possible. Thank you so much, Anjali. Listening to you was fantastic and amazing. And Mrs. Menon, thank you. Thank you, everyone. And thank you for Forum for Breast Protection. Thank you, Colonel Pant and Dr. Sareen. I think the forum does such a great job. I think we have to drive the clinical exam, the breast exam in the villages, especially since the Tata study has come through.
Yeah.
Thank you guys
so much.
Bye. Have a good day.
Thank you so much, everyone.
Thank you so much.
Thank you so much, Dr.
Thank
Bhavna
you so
Sirohi,
much.
Dr.
I'd
Shubham
like
Pant.
to invite, Dipal, you go ahead, sorry.
Okay, thank you so much, everyone. Thank you, Dr. Ramesh Sareen, Dr. Shubham Pant, Dr. Bhavna Sirohi, Ms. Anjali Sapra, and Ms. Prasanna Menon. Food is medicine, so you might as well pick up your prescription in the kitchen. So let's go local, let's go seasonal, and we have a plethora of superfoods, in our diets to ensure that we're on the health track. Dr. Bhavna Awasthi, she's the Chief Medical and Clinical Oncologist at Indian Spinal Injury Center, New Delhi. She's been involved in global drug development research as Vice President of Medical Management at Syneos Health, a global contract research organization. I request her to kindly give the vote of thanks. You need to unmute yourself, Dr.
Deepali. And this is such a wonderful session that we all attended. And Bhavna, thank you so much for thanking everyone already on the behalf of the forum. I think it's wonderful. And first of all, a big thanks to the entire audience. So good and engaging. And thanks to everyone who participated. Deepali, you as the MC always, Bhavna, and Dr. Vanita, Aditi, Sadhna ji, Harpreet Malik, Mrs. Prasanna Menon, and Anjali Sapra. You were all wonderful and very, very informative. I'm sure all of us and the entire audience has really gained a lot from the deliberations today. And of course, thanks to Shubham Pant for the book, which is going to be not just, for a small gathering of people, it's going to go much, much beyond. And that's the beauty and the strength of a book that it can bring in. Of course, thanks to everyone from the forum. On behalf of the forum, Dr. Vanita Kapoor, Karuna, Dr. Pant, Deepali, and Bhavna Sirohi. And of course, Madam Dr. Ramesh Sareen, always the soul and the doer, basically, of the forum. Thank you so much for your encouragement and your leadership. I think we can close this call and look forward to many more such meetings together.
Thank you.
Last but not the least, the two people that I need to thank is Colonel Pant, who is working behind the scenes. And anytime I have a problem in making a program, bringing up somebody, he's there and he does the thing right on the job. Like before I finish my sentence, the work is done. And Karuna, of course, handling the Zoom and doing the flyers and the information to people and all that. And these are the two people I thought work behind the scenes and work much more than, upfront people like us. Thank you so much, everybody. I wish there was more participants, but we'll have another session like this again in 2-3 months' time. Thank you. Thank you, everybody.
Thank you, everyone. And if there's any question or you need to get in